For this exercise, you will be provided with a piece of lung which will have a wound in it, and some dirt and foreign bodies shall be present in it. The first step to debriding this wound is to clean it with the help of a swab dipped in an antiseptic solution. As you can see in this exercise, this cleaning is done from center towards outwards. Very gently, all pieces of foreign body are removed. The swab is taken to the depths of the wound and foreign body is removed. Once this has been done, this is followed by irrigation of the wound with the help of saline. Saline is filled up in a 20 cc syringe, and with pressure the wound is irrigated. This helps in bringing out the foreign bodies as well as cleaning the wound from inside. Here you can see, once saline was pushed into the wound, some foreign bodies have come out. The next step is palpating the wound from inside. Sometimes there are some edges of the wound which are overhanging and a cavity is lying underneath it. To make sure that such a thing does not happen, you can increase the size of the wound and then palpate it thoroughly from inside. As you can see in this video clip, there was a large piece of foreign body which was present inside the wound and did only show up once the wound was enlarged in size and palpated with the finger. This increasing the size of the wound also helps in cleaning the depths of the wound. Once this is done, all dead tissue from the edges is excised. Over here you can see a scissors is being used to excise the dead tissue till the point where you see healthy tissue or tissue which is bleeding. This cleaning is done in a clockwise manner, that is, you start. The next step is the placement of a drain. Once the wound has been cleaned thoroughly, a drain shall be kept into this cavity. Ideally, this cavity should have dependent drainage. The drain we will use for this exercise is Penrose drain. Over here you can see that an artery is pushed through the wound cavity and brought out through the skin after making a small hole with the help of the knife. Here you can see the Penrose drain. For the sake of this exercise, you shall use the finger of a glove instead of the drain shown here. The other drain that you can use and which is also shown here is the corrugated drain. Once the drain is placed, it is fixed to the skin with the help of a stitch. The suture is shortened. Afterwards, a safety pin is passed through this drain so that if unfortunately the stitch is To cut through, the drain won't go inside the wound. After this, wound is again cleaned with a soaked swab in pyodine or some other antiseptic solution, and the swab is kept inside the wound. Once this step has been done, the wound edges are closed with loose stitches.